My name is Tara Parker and I'm a director at WellChild. We recognise that this is an extremely worrying time for parents of a child with a chronic respiratory condition. And with the escalating concerns over COVID-19, we have made this short film to try and answer some of your many questions. What is coronavirus or COVID-19?
COVID-19 is an illness that can affect the lungs and airways. The illness is caused by a virus called coronavirus.
If my child is on a ventilator, is there a higher risk of them contracting COVID-19?
The risk of getting the virus is the same for all children. However, if a child is on a ventilator, he may develop more severe symptoms. Our advice for children on a ventilator would be to follow the current shielding guidance from the government and also to continue all the medication, the ventilation timings, settings, and also to continue the chest physiotherapy program if your child has a physiotherapy program. Please stay at home. The shielding guidance may vary between ventilated children. For example, if your child has only obstructive sleep apnea and is on a CPAP at night only, but very well during the day, it could fall into the categories like for all the other children.
But what do parents do if their child does become unwell?
If your child becomes unwell, please follow your escalation plan, please follow your chest physiotherapy regime, and if you don't have an escalation plan, contact your lead respiratory team from the hospital. If it's difficult to contact them, we would advise you call 111.
If my child uses oxygen at home, what is the risk?
The risk of getting the virus are the same like for all other children. However, your child may develop more severe symptoms compared to children without an underlying medical condition. Please try always to continue to take your regular medication, continue the same medical treatment that you have, and a physiotherapy program for your chest if your child has a physiotherapy program. The carers are still allowed to come to your house if they are well, and if your child becomes unwell and is on home oxygen, please follow your escalation plan or contact your respiratory team, or if you can't contact your respiratory team, call 111. If you can't get access to any medical advice and you have to attend the hospital, we would advise you that you have or you bring with you a bag with a week's supply of consumables.
If people's families had the flu vaccination this year, does that protect them from COVID-19?
No, the yearly flu vaccination will not prevent you from getting COVID-19.
What can parents who have a vulnerable child do themselves to protect that child?
Keep in close contact with your community teams by telephone. You could also contact your child social services team to inquire about help with utility bills or any extra costs you're incurring during this time. And currently hospices will be considering when and if they can offer support and emergency respite care for children who are well where families are exhausted. If your child is known to one locally, make contact with them and explore this. We will highlight the most vulnerable children and families to the hospices that support our children. The Children's Long-Term Ventilation Service will support training for additional carers and family members if this is a temporary solution that works for you. We are asking you not to contact your hospital for advice if your child is well, as we are receiving an increasing number of calls at this time, and we want to prioritise our time for the phone calls where a child is clinically unwell at home. Please do contact your GP, community paediatrician or community nursing team with general queries regarding your child's medical condition. But if you are concerned about anything regarding your child's respiratory care, please do contact your hospital team for advice.
And in regards to carers, are carers still allowed to come in to look after my child when they're unwell?
If the carers are well, they are allowed to come and continue to look after your child. But obviously, if the carers are unwell, then they need to stay and self-isolate.
And is it okay for parents to let their child use their garden?
If they are lucky and they have their own garden and it's only for the household, yes, it would be great if you use the garden.
For children who are not on ventilation but who regularly suffer with severe chest infections and need to come into hospital and are under one of the London respiratory teams, what should they do at this time? Should they then avoid going to the hospital to reduce the risk of contracting COVID-19?
If your child has symptoms of any illness, we would advise you to do what you normally do. If you're concerned about your child, please call your GP as you normally would. If your child has symptoms that you can no longer manage at home or you are unable to manage at home, please dial 111. And if you are extremely concerned about your child, please call 999 as you normally would. If your child does need to come to hospital, we would advise you to bring with you all of your child's medicines. And if they are on any equipment in the home, if you could bring 1 week's worth of consumables with you, that would be really helpful. There are strict infection control measures in place in all the hospitals across the country to protect your child and you if your child does need admission into hospital.
Can parents and carers travel and go outside with their child at this time?
We are following the government advice, and this is not to leave your home for any unnecessary travel. Children on non-invasive ventilation that are not required to shield can go out once a day for exercise as per government advice. It is permitted to go out once a day for exercise provided that you practice strict social distancing and maintain 2 metre distance between people outside of your household.
What can parents do if their child's carer is no longer able to look after their child?
Well, with reduced carers available, we're going to sort of need to look at the child's needs, and you'll have to think about when's the busiest part of your day, whether their needs are more in the daytime or the night time, and perhaps have a discussion about your care provider so that they can help you through and prioritise the tasks that need to happen. We accept that you might get some temporary carers who might not have all the skills you need, so they might be able to look after a tracheostomy but might not be trained on the ventilator, so you're just going to need to utilise the skills of any carer that is available to help you. You also might want to look at whether there's other family members that could help you, and if you have other family members that could step in, then our nursing teams will be able to provide some support. So perhaps contact your children's long-term ventilation service and see if we can provide some essential training for family members to help you through this time. For some families, we are accepting that when there isn't carers available, then it is appropriate for your child to be in the same room as you with alarms on their ventilator and a saturation monitor on them overnight to try and keep them safe, and that you may need to contact your team to help you make sure that those alarms are all set up and working appropriately to allow you to safely look after your child overnight without you becoming completely exhausted by staying up the whole time. Don't change the settings yourself. We'll help you with that if you contact us.
Okay, and if parents have taken over providing that level of care and they themselves become ill with the virus, what are the options then?
So get in touch with us and let us know. Some of the hospices are still running and may be able to take over if there's no other people that can step into the breach to look after your child. But let us know, and we're trying to make sure that the most at-risk children are given a backup and an extra bit of help if they need to.
Where can parents reach out to if their equipment is broken or not working and they don't want to risk coming to the hospital?
So please follow your home ventilation care plan or care plan that you already have and follow that advice. If you're in any doubt, then do get in contact with your respiratory team.
So how do families get their consumables?
So first of all, it's a really good idea to keep a log of your consumables so you know what needs replenishing and when. Give your community team plenty of notice for reordering as you normally would. Liaise with your community team to discuss your needs in case your family requires a period of isolation. We would advise you not to stockpile consumables, please. If your child is on oxygen, your oxygen supplier will replenish the oxygen as it is needed and not leave you with any extra cylinders. So please make sure you give your oxygen supplier plenty of time to replace them.
And if parents have children that are ventilated via non-invasive face masks, what are they to do about the cleaning of those if they can't get hold of Milton solution?
Yeah, so some centres advise washing with warm soapy water. Other centres advise using Milton to sterilise depending on the child's need. We would advise at this time to wash all your circuits with warm soapy water, allow them to dry completely before re-putting everything together. Make sure you have enough of those consumables, and to do that weekly, make sure you've got clean hands before you change anything over.
If you are a carer looking after a child who is showing symptoms of COVID-19, what should you do?
If your child has symptoms of COVID-19, in the first instance, we will advise that you follow your escalation plan and contact your medical team. As regards with the carer, we would advise they contact their employer with regards to the correct and the most appropriate personal protection equipment to allow them to continue to come to your house and look after your child.
So this is going to be a really challenging time for lots of families with children and young people with complex health conditions. What can people do to protect their mental health and to help them get through these challenging times, particularly when they're in isolation?
Yeah, I think it is a really, really difficult time. And I suppose it's really important to remember there's no kind of right way or normal way to respond to this kind of totally unprecedented crisis. It's important that family members are able to acknowledge the feelings they're having and to talk about those with one another. And those can be feelings of anger, frustration, worry, or anything else. That said, given how unpredictable and uncertain these times are, it can be really helpful to focus on what they can control. And that might include putting together a timetable, making a kind of flexible routine, anything that kind of people feel they can have some control over. And with timetables like that, what we'd recommend is that people remember to include activities that family members find fun, enjoyable, that they promote connection with others, and that they promote a feeling of kind of achievement for all the people in the family.
Please wash your hands carefully for 20 seconds and use the sanitizer gel.
Please be aware not to touch your eyes, nose and mouth.
Please practice good respiratory hygiene. If you need to blow your nose or cough, please use a tissue over your mouth and nose and place in the bin and wash your hands after. If you don't have a tissue available, please use the inside of your elbow to cough or sneeze, and clean your hands as soon as possible with sanitizer or warm soapy water if you have a sink available.
If you need to go out, please practice social distancing, so stay 2 meters apart from everyone around you.
So please stay at home and stay safe.
And remember to be kind to yourself and to those around you.